hip arthroscopy, contraindications, advanced degenerative disease, hip ankylosis, joint contractures, severe osteoporosis, or protrusive portals. 5 portals: proximal anterolateral portal, anterolateral portal, posterolateral portal, anterior portal, and mid-anterior portal. Proximal anterolateral portal, 2 cm anterior and 2 cm superior to the anterior superior border of greater trochanter. Risk is superior gluteal nerve to access peripheral compartment. Anterolateral portal, 2 cm anterior to the tip of greater trochanter, is primary viewing portal. Posterolateral portal, 2 cm posterior to the tip of the greater trochanter. Anterior portal is intersection between the superior ridge of greater trochanter and anterior suprailiac spine. Lateral femoral cutaneous nerve is at risk. Normally, the patient is supine or on traction table, 50 pounds weight is with a well-padded pineal post. A needle is nitrinol, nickel, and titanium guide wire, and a capsular dilator with a 70 degrees orthoscope. Pressure 50 to 60 mmHg. These patients have a hip arthroscopy should be in non-arthroscoplasty hip registry. Compartment: intra-articular central compartment, intra-articular peripheral compartment, and extra-articular 3 compartments. Rehabilitation: non-weight bearing or partial weight bearing for 1 week with gradual progression of full weight bearing. Complication: chondral injury, pudendal nerve injury due to the traction against the post.